New this morning, you probably know that October is Breast Cancer Awareness Month. And yesterday we were talking about new research showing fewer women are dying from breast cancer. Of course, that's a great thing, but it doesn't mean that you should be any less vigilant on that subject. So Gina has more on that this morning.
Hey, Scotty, you know what? I'm sorry, I was in the wrong spot. So
That's
I'm just going to move right across the camera here and over to the right spot so we can get this interview done, because it's an important subject to talk about, right? Yes. So let's get right to it. So the CDC says breast cancer is still the leading cause of cancer death amongst women overall, and more than 200,000 women are diagnosed with it each year in the United States. So joining us to talk about symptoms and screening options as well as risk factors, Dr. Tara Ostrom. Dr. Ostrom, good morning. This is such an important conversation, and I want to start with the risk factors right off the bat here. We know that if you've got a history in your family, that is an important factor to take into consideration. But there are other lifestyle issues that put us at particular risk that maybe we could or should be avoiding?
Yeah, I think with this being Breast Cancer Awareness Month, it's good to kind of just discuss what some of those things are. So some risk factors and some things that you can do to reduce breast cancer risk is, exercising regularly and keeping a healthy diet, limit alcohol use, and then talk to your doctor about some medications you're taking that could impact your breast cancer risk, such as hormonal medications and oral contraception.
So if you are taking those kinds of medications, which are incredibly common, should you be more vigilant about looking out for breast cancer?
I think it'd be good to make sure that you're seeing your doctor at least once a year for a wellness visit and kind of discuss how that impacts your breast cancer risk.
Well, let's talk about the signs to look for and the screenings that medical professionals are recommending. I remember in my day, they were telling us to kind of do your self-exam in the shower at least once a month. Is that still the protocol? And what do you recommend?
Currently, that's not the protocol for women to be doing that on a regular basis. It's more of just having like breast awareness and kind of knowing, if there's any lumps. And the symptoms that you'd be looking for is if you noticed a lump, or if you had a significant rash across your breast that looked like maybe a skin infection, that would be important to know. And any breast pain or nipple discharge would be some symptoms to bring to your doctor right away.
Got it. And let's talk about implants. Do those still have any kind of effect?
Implants you can still get a mammogram with an implant. They just got to be just really careful, and there's just techniques to still be able to do the mammograms even though you have an implant.
Okay, Dr. Ostrom, since you brought up mammograms, talk to us about how often we should be getting them and when should we start?
So it's recommended for women between the ages of 50 and 74 to get mammograms every 1 to 2 years. If you're younger than 50 or older than 75, you should talk to your doctor about your particular risks and what they would recommend for you based off of the current guidelines.
And we are just, coming out of the pandemic. Can you talk to me about how COVID has affected that? Have we seen numbers increase? Are you seeing people getting back to regular screenings?
I think we're just starting to see some women getting back to regular screenings because the guidelines are every 1 to 2 years. We're finding that maybe some people, it's like now 3 years because they didn't keep track of when their last one was. But it is, it's time to kind of, take a look at when your last mammogram was done and try to remember when that date was and find your records.
Dr. Ostrom, just so that we're not in the dark, let's say we find something. What can we expect as far as treatment is concerned? And it seems like more and more breast cancer is something that is survivable.
Breast cancer is a very treatable cancer, and mammograms and just breast awareness help with early detection. When they're found, commonly most women can have breast conserving surgery where just the cancer and just a kind of a lump was just removed, along with taking a pill for about 5 years that will go and find any cancers any cancer cells throughout the body to help remove them. More advanced cancer might involve more extensive surgery or radiation therapy.
All right, Dr. Tara Ostrom, thank you for this important conversation. Really appreciate it. And wishing you good health, my friend.
Thank you for having me this morning.